start again. My name is Dr. Catherine Glass. Thank you so much to those who have joined the webinar this afternoon. I'm just introduce myself. So I'm the Director of Clinical Workforce and Strategic Partnerships at Dr. Care Anywhere. I'm also an NHS GP, and I also appraise NHS GPs. I'm not a mum, but I have lots of friend mums, and being the only GP amongst my friendship group, I end up being a real listening ear to all their mum issues. Normally happens over a glass or two of wine, normally as well over the dinner table, but I'm quite in the know with regards to problems that both pregnant women are facing and also those kind of typical issues that occur just after birth. I think we're just very keen to hold these webinars essentially to support mums, particularly in the current climate, or mums to be rather. I hope you're all doing okay. I know it's really sort of uncertain times, but just to say that we at Dr. Care Anywhere are definitely here to support you, and any questions you have at the end of this webinar, do feel free to ask, or indeed use our contact email address to ask any questions you may have. So today, what are we talking about? We're going to talk about common issues for mums after birth. Just to let you know, tomorrow we will also be doing a webinar in terms of specific problems to newborn babies, to help mums to know when and when not necessarily to seek medical health care. But today, common issues for you mums after birth. And sorry, just before I go on, a shout out to my colleague, Dr. Jemma Shafier, who is also a GP who works at Dr. Care Anywhere, who's very kindly put together these slides today. So just a little bit about our agenda. What are we going to talk about? So we'll talk about contraception issues, your long-acting and shorter-acting options, a bit about breast problems shortly after giving birth, low mood symptoms, and all those delightful body changes that seem to happen after giving birth. So first, let's start with contraception. So just to warn you ladies, it's possible to get pregnant 3 weeks after birth. So no relaxing from that regard, unless you want to be producing babies every 9 months. Having had a friend who's got caught out, I don't think she necessarily recommends that, but good on you if you're one of those mums. Sex after delivery, often I've heard my friends talk about telling their partner not to come near me. It may well be the last thing on your mind, given what your poor vagina has been through in terms of delivering the baby, or if you've had a cesarean section, you will be extremely sore. But just to make you aware that if you are embarking on intercourse soon after delivery, it may well be painful. You may have a bit of discomfort. That is totally normal after birth. And actually, I would say takes around about 6 weeks to 3 months to completely feel, dare I say, more normal down below. But if you feel the symptoms are persisting past that point or seem to be getting worse, or rather the pain gets worse during intercourse, then do just touch base with your GP. So back to contraception, things which may affect your choice of contraception. Well, of course, there's a personal preference issue. You know, are you breastfeeding or not? Do you suffer with any medical conditions which rule out certain contraception? We need to take account of how soon after birth it is. Some contraceptions you can use straight away, others you need to delay their starting. Of course, you know, if you are planning more children, certain types of contraception may be more beneficial than others. And then any potential risks or side effects of the various contraceptions. So let's talk a little bit first about long-acting contraception. So we have two types of coil, the Mirena coil and the copper coil. Mirena coil is a progesterone-only coil. That's it in the right-hand corner, so a sort of T-bar implant. Those wings, which is the T, essentially fold down and form part of the trunk of the T in terms of when it's inserted. It can be inserted within 2 days of giving birth, or if not, you need to normally wait around about 4 weeks after giving birth. And it can stay in for up to 5 years, so it's a great longer acting contraception. So great for those mums that perhaps certainly want a significant break before they have another one, or indeed have completed their family. And the marine coil or the progesterone only coil is great if you are suffering from heavier periods that can come on after giving birth. What's the other type of coil? Well, it's the copper coil. So this is a non-hormonal contraception, but sadly it can make periods a bit heavier. Again, like the marine coil, you can insert it within 2 days of giving birth, or again, you would need to wait the 4 weeks and after birth. And this one lasts that bit longer, so 10 years. So probably I would suggest very much there for those women that have completed their family. And they're great, the coils, in so much that you don't need to remember to take, dare I say, a tablet or an injection, you know, every day or every 3 months. Talking of injections, that's the third longer acting contraception available. So this is a progesterone only contraception. It's normally given into the buttock and it lasts for 3 months. The alternative to the injection is the implant, which is a little matchstick, which is there in the second picture on the right, that just slots in under the arm. And the implant lasts for 3 years, the injection lasts for 3 months. All I would say is some women don't necessarily respond brilliantly to injected progesterone, and of course if that is the case, we can't take that injection out. So I would simply say that if you have had reactions to progesterone in the past in previous contraception that you've used, just be a bit mindful of having progesterone in this way. And just, I think the other thing to note is it may completely stop your period, so no need to panic. You hopefully won't be necessarily pregnant again. Progesterone is classic when taken this way in terms of stopping periods. Right, so what about your shorter acting contraception options? So you've got the progesterone only pill. You can take this straight away after birth. It's taken every day. It's relatively low risk. It's used commonly and it's well tolerated. You've also got the combined pill, the contraceptive patch and the vaginal ring. These have been grouped together because they all contain estrogen and progesterone. You can start these types of contraception 3 weeks after giving birth, assuming that is you're not breastfeeding. The reason being is that in those early stages, some of the estrogen can be transmitted in the breast milk and given to baby. But after 6 weeks, certainly the combined pill can be considered, and that is assuming that you don't have any other risk factors that prevent you having a combined pill or combined contraception, and that tends to be linked to the estrogen component of that contraception. So if you have a history of things like blood clots, you would probably need to steer clear from these types of contraception. And the combined pill, patch, vaginal ring are great at helping to control periods, and you tend to have the bleed during the sort of the pill-free week or the patch-free week, so it really tends to regulate periods. And also women can back to back their combined pill as well, if they want to sort of skip a bleed, so to say. Condoms, of course, that's an option for you, and these of course can be used straight after birth. Just to mention the lactation method, so just be mindful, it's only deemed to be suitably effective if you are fully breastfeeding with no top-ups or dummies, until your periods start or you start reducing the feeds for a maximum of 6 months, but maybe shorter. So I wouldn't necessarily recommend this as a method, but it is a method if you are completely anti using those other types of contraception that I've talked about. Right, so a bit about breast problems. So, my goodness, I've had friends who have suffered from what looks like horrendous mastitis, also seen a fair few patients with mastitis. So this will cause painful red, swollen areas on your breast. The pain may increase on feeding. Friends of patients have used the term like passing razor blades through your nipples. Why does it happen? Well, it's caused by a buildup of milk in the breast. It often comes on in the first 6 weeks or when weaning. But just to be mindful that it may become infected and lead to an abscess if not treated. So some mastitis we can just, watch and monitor and review. Other types of mastitis can represent these nasty underlying abscesses. So in terms of sort of how we conservatively treat mastitis, we'll start with self-treatment. If you're feeling completely well in yourself, apart from these tender red spots on your breasts, use hot compressors, so nice warm flannels to help open those breast ducts. Would you believe you're expected to feed from that breast first, even though that's probably the last thing you want to do, but by continuing the drawing down of that milk, particularly in those congested ducts, can help to ease those horrible symptoms from mastitis. Try to express milk between feeds for that reason I've just mentioned above. Be sure to massage the affected area as well, which can again free up that milk. But just to be mindful, if it's not improving within one to 2 days, or you start to feel unwell in yourself, develop fevers, you do need to speak with a GP. And this can be a GP in person or dare I say online, so via phone or video consultation, to see whether prescription of antibiotics are indicated. Right, so now thinking about low mood. So low mood after pregnancy, so having a new baby can be difficult and extremely overwhelming. There's such a build-up, you know, there's this 9-month build-up. There's a real expectation, a societal expectation that this is going to be the best thing that ever happens to you, and that, you know, you're just going to love it at every stage. But baby blues are extremely common, and they tend to happen just after pregnancy, sort of between the sort of day 0 and day 10. Baby blues are due to hormone changes, as you would imagine, after your uterus has expelled your baby, and whatever the way that may be. So many hormones going around your body, from the brain to the ovaries and so on. So it's almost expected that you're going to feel slightly out of sorts and slightly muted in terms of how you're feeling. But just to reassure you, this should lift. It shouldn't last for certainly more than a couple of weeks, but unfortunately you may well end up feeling a bit low, a bit anxious, a bit irritable. So probably worth just giving your partner the heads up. Now, more seriously, just thinking about postnatal depression. So this is really quite an unpleasant condition. In my mind, it's fairly common actually in general practice. I have a fair few mums that have suffered from postnatal depression. It affects about 1 in 10 women, so about 10% of us. Usually comes on between 2 to 8 weeks after birth. And the really sad thing is that many women suffer in silence. Again, there's this expectation put on mums, this is the best thing, you know, that's ever happened to you. You know, why wouldn't you be, you know, full of joy and loving your baby and telling all your friends that, you know, this is the best thing that's happened to you. And I think as a result, women don't tend to come and see us GPs or talk to their friends very easily because of the way they sort of should be feeling. But just to warn you, if you're feeling down or depressed, that feeling doesn't lift. If you're feeling hopeless, if there's a lack of interest in your baby, or there's just some difficulty bonding, if you feel that you're crying all the time, concentration's poor, you're feeling unable to cope, and there are even thoughts about harming your baby, don't worry, dare I say, this is postnatal depression. And it's what's really, really important is that you tell people about the way you're feeling, and share your thoughts with your friends, and most specifically with a healthcare professional, so we can basically get you the help that you need and get you feeling better. So lots of help out there. You can speak to GPs, your midwife or your health visitor about your mood. It is usually diagnosed by us GPs. And again, you know, online GPs are easy to access and can easily provide advice. And just to make you aware, you know, online GPs doesn't just mean our service Doctor Care Anywhere. NHS GPs in the wake of COVID-19 have had to review how they look after their patients. So we imagine that after COVID-19 pandemic calms down, which I'm very confident it will, and hopefully soon, there is the likelihood that your GP will be offering appointments in different ways. So that's either going to be face-to-face, you know, as per the traditional model, but also we imagine they're going to be opening their services up more by phone and by video consultations. And there are a lot of things, a lot of issues that affect mums that can be very easily managed remotely or online. Okay, so talking about sort of more specific treatments for postnatal depression. Of course, that depends on how unwell you are and your own preferences. So as I've mentioned before, support and advice, talk to friends and family can help, give a lot of support. Having time off as well from looking after your baby. Apparently me time is pretty non-existent once your baby comes along, but do try and sort of set up something at home so that you are able to have some time out. And it's nice to be able to get support with worries that happen once you've given birth. You may even be a single mum, so issues potentially over money, any relationship issues, any feelings of loneliness. And then antidepressants, I would say, definitely play a part in the treatment. They can really help with the physical symptoms, such as those symptoms of poor concentration and lethargy. And pleased to say that not all, but certainly a good bulk of antidepressants are safe in breastfeeding. So you don't need to make a choice between getting treatment and breastfeeding your baby, which is great. And then, of course, talking therapies. So it can be really helpful to have someone external, someone there independent who is just able to give a very sort of pragmatic, neutral view. There are different types of talking therapies, cognitive behavioral therapy, interpersonal therapy, guided self-help. Of course, it may be difficult to access for the small baby, but again, these therapies are often available, remotely or online again. So it may be a Skype call with a therapist, not ideal, but at least it means that baby can be in the background whilst you're chatting to a therapist. Fantastic. Great. So now just moving on to the delights of the body changes that can happen. So of course there are a lot of body changes during pregnancy, and I know a lot of my friends were a bit surprised at how their body didn't just simply, revert back to normal after giving birth. So there's a lot just to, be prepared for after giving birth. So let's go through them now. So that pregnancy bump of yours can take 6 to 8 weeks to reduce. I would suggest even longer sometimes. It can take up to 3 months. And if this is your second or third pregnancy, some women are left with a bit of a permanent bump. So don't be too hard on yourself. And, with a series of just dietary sort of monitoring and certain exercises, you can bring that pregnancy bump down, but just do it at a pace which you're happy with, and or you may just be simply happy to embrace your new body, and if so, good on you. Stretch marks, so you're likely to get them over your breasts and over your tummy, may even get them over your thighs as a pregnant woman. These will fade over time to a lighter coloured mark. Again, things take time, so give it a good sort of 6 to 12 weeks. Sometimes the application of bio oil can just help your skin to heal that bit quicker. Sex drive, for obvious reasons, can be reduced after childbirth, as we've talked about previously, but it's likely that sex drive will return to normal, may take a bit of time. You will be far more busy if you are becoming a new mum for the first time. But if you feel that your libido is especially low and not bouncing back, and or it's a problem for your partner, do again feel free to liaise with your GP just to find out if it's normal or not. Hair loss, so I have had a lot of pregnant women, or rather women give birth and come to me saying, the hair is so thin, it's really falling out. This is due to the reduction in estrogen, which happens after giving birth, but your hair classically goes back to the pre-pregnancy condition. So whilst it does feel like you're losing hair, actually you're simply going back to your pre-pregnancy mane, dare I say. So don't worry too much about that. Of course, if you're getting patches of baldness, completely different, do feel free to speak with a GP. Also, just make sure you look at your diet and make sure you're getting a variety of vitamins and minerals in. If you are excluding any food groups from your diet, be sure to sort of replace them using an over-the-counter vitamin. And piles, delightful. So common during pregnancy, common after birth. You've had a baby growing in your tummy, pressing on your colon, causing all sorts of issues with constipation, and as a result, it's very natural and normal for these piles to develop. So piles are prolapse rectal tissue. They should improve, again, within a few weeks after birth. They tend to improve better if you're passing softer stools, if you're keeping well hydrated. Again, you have to be patient with them, give them a good few months to return to normal, but if they do persist and or are very painful and or bleed, do again feel free to speak to a GP either remotely or in person. Right, pelvic floor, my goodness, it takes a bit of a battering. So what is your pelvic floor? So it's a hammock of muscles which supports the bladder, the womb, and the back passage. And of course, during pregnancy, it relaxes and can be stretched quite considerably during birth. And why is it important? Well, it really helps control the passing of urine and the opening of our bowels. So if your pelvic floor is lax, you know, having good urinary control and good fecal control can be impacted upon. What can you do about it? However, pleased to say that the evidence suggests that this is within your control. So pelvic floor exercises have been shown to be really, really beneficial to help stop urine leaking, wanting to go to the toilet often, and can help improve any sort of prolapse sensation down below. And look at that, makes sex better too. So get doing your pelvic floor exercises. How do we do them? Well, by all means do them as I talk them through, but several ways of improving your pelvic floor. One is to squeeze and draw in your bottom as if you're holding in wind, something that I definitely don't do very often nowadays. Squeeze around your vagina and bladder as if you're stopping the flow of urine. So that should feel pretty straightforward. Long squeezes, hold for as long as you can, no longer than 10 seconds, and then relax. And then the short squeezes, the pulsating, the squeezing of the muscles and letting them go immediately, and do this until the muscles get tired, and aim to build up 10 repeats of each exercise at least 3 times a day. And you should find, I wouldn't say day by day improvement, but certainly week by week improvement if you're able to do these exercises. And just to say, there'll be plenty of information online in terms of you know, giving you ideas in terms of pelvic floor exercises. Just to talk through other changes, so separated stomach muscles can also happen to some women after giving birth, and this feels really quite barbaric. It's the term we use in the medical profession is diastasis recti, or divarication. So what happens is the stomach muscles are pushed apart. As the womb grows, those muscles become longer and weaker, and you literally feel like your stomach contents is sort of pressing through between this gap. But again, to be reassured, this should improve around about week 8, week 12 after birth. It can lead to back problems, so you may need physiotherapy, but it doesn't sort of resolve on its own. And you can be referred by your GP, or even do a self-referral depending on which part of the country you're located in. And again, those pelvic floor exercises that we talked about can help. So just to really, hopefully, just really to throw yourself a bone. So body changes after pregnancy, everyone is different. So try not to compare your post-pregnancy body to other people's, particularly those celebrities on Instagram and Daily Mail columns and so on. Gentle exercise can be done early after giving birth. So the emphasis there is gentle, so do get moving, particularly, you know, if you've just given birth, you know, beautiful weather at the moment, get out there, look after yourself, try and put yourself, apparently you can't put yourself first as much anymore, but just try and look after yourself as much as possible. So go for some lovely walks, get doing your pelvic floor exercises daily, try and find some sort of routine, even perhaps go for a swim if your partner or a family relative can step in just to look after the baby as you do that. And only do as much as you feel comfortable with, and listen to your body. If you're doing something that your body is really not happy with, it will tell you, and perhaps you just need to ease off a little bit. And along those lines, just avoid the high impact exercise until after your 6 to 8 week check with the GP. So perhaps avoid running and any sort of jumping jacks or any other kind of aerobics in that time frame. Great, and I think just finally, just to sort of emphasize, you know, the role of online consultations. So speaking to a GP online is quick and easy. Certainly with Dr. Care Anywhere, you can book an appointment within 1 to 2 hours. You're not having to wait 1 week, 2 weeks, even 3 weeks to speak to a GP. We can discuss your problems confidentially from the comfort of your own homes, instead of having to pack up yourself and baby, it can be much more convenient for mums, and it may be easier to discuss embarrassing problems, just without having to feel that you have to be examined. And some conditions, they don't need to be examined, but if the GP does feel that they need to be examined, they will be sort of saying, look, come on down to the surgery, let's take a look at this because the diagnosis sounds a bit unclear, and so on. And of course, with online consultations, what can we do? Well, we can offer, practical medical advice. We can do referrals, and we can prescribe and give various and talk through various treatment options that you have. So even if you use online GPs for a source of resource, for a source of advice, even that alone hopefully will be of benefit to you. And I think that draws us nicely to the end. So I'd just like to open up just to see in terms of any questions anyone may have. Hello, Devon. I think you're my only attendee this afternoon. Feel free to, what I can do is I can unmute you just in case you have, like, to tell me a bit about yourself, and or if you have any questions.
Hello, can you hear me?
I can hear you. Hello.
Yeah. So I was interested from a medical point of view. So I'm a practitioner as well, and we don't get very much teaching on how to support women with postnatal depression apart from antidepressants and CBT. And so that's why I was tuning in. So it's been very helpful to learn about the pathophysiology, and that it is a hormonal sort of response, and that there is a degree of normal as well. So that's useful to know. Yeah. But I just wondered, what have you found from experience gets women back to normal, if it were? Because I think a lot of women often have too much on their tray, if that makes sense. And
absolutely. So I think it's just, for me, it's about the early diagnosis, and actually that tends to start in the sort of pregnancy time frame. So finding out from the pregnant mum if there's any history of any mental health stuff. So there's definitely been a link, unfortunately, with those women who have a history of anxiety or depression being on slightly higher risk of postnatal depression. So I guess the first thing to say is flagging those women as soon as possible, and really making sure that they have potentially a little bit of a different plan, when they do give birth, so we are able to pick up on the earliest signs of postnatal depression. I think actually that ties into my next point, which is, I think unfortunately, the way, sorry, I don't know what type of practitioner you are, but certainly from a general practice point of view, because of time pressures, unless the woman brings it up, we don't necessarily really inquire. So I think it falls on us as practitioners to really make sure we delve, because as I say, I think mums particularly, women particularly, are very good at putting a brave face on things. So really just making sure we do take the time to probe. And actually, women may not know they have baby blues or postnatal depression, so they just assume that that's, dare I say, the normal. So as I say, the questioning can often help to unpick that a bit. And then I think in my mind, we don't want to medicalize as postnatal depression, but equally it can be very severe. And I've also seen postnatal psychosis or perinatal psychosis, which is very, very concerning. So I think we just need to be just creating a series of regular appointments so we can look at progress, maximizing that support network. I feel that that's really important. So, finding out, do they have a family? Do they have a supportive partner? Are they involved in NCT groups? Do they find that NCT group helpful or not? I know my friends have had a mixed experience with the likes of these sort of support groups that there are. And I think that in itself can provide a lot of, dare I say, the treatment. And then also not neglecting the kind of the stuff that all of us should be doing anyway, eating well, sleeping well hard when you have a baby, moving as much as possible, and just making sure you get some rest. So making sure they're looking after themselves as much as possible. But then at the series of reviews, just thinking, look, when do I need to bring in the therapy? When do I need to bring in medication? But a lack of improvement in my mind can be a bit of one of the first red flags.
And one thing I do notice is a lot of women are, sometimes it's clinical, but most women are subclinically hypothyroid, which again I think is this whole running around sort of burning the candle at both ends culture that is the world most women live in. And so a lot of women are put onto thyroid hormones like thyroxine during pregnancy. Just wondered if you had any, like, is that beneficial, or does that affect depression and recovery post natally as well, or how that plays into things?
Yeah, so good question. So hypothyroidism is obviously one of the symptoms of hypothyroidism can be low mood. However, I often find my hypothyroid patients, whether they be pregnant women or not, or women that have just given birth, they often find the thyroxine isn't particularly helping in that area. But don't get me wrong, I have had a few women who have simply presented with low mood, and after a blood screen, that's been the cause, and they've responded beautifully to treatment. So I think we need to identify it. I think we need to, monitor the thyroid levels, but not just attribute that totally to the cause of their low mood. So make sure they're in the therapeutic range with regards to their thyroxine level and their TSH level, but not to neglect the other stuff. Be my sort of response to that.
No, it's true. It's sometimes with these things, it's such a holistic approach. It's really important. So many things can contribute to a diagnosis. It's really, but no, it was a very good lecture. Thank you so much. I learned a lot.
Where are you? What kind of practitioner are you, and where are you based?
So I work full time in the NHS, and I work in hospital medicine. So I'm do you know ACCS, where you do intensive care, emergency general medicine? So essentially, but do quite miss sort of the holistic aspect, because I think it's it's the same in I admire GPs being able to see people in 10 minutes, but in our world as well, it's very, very pressurized in terms of how in depth you can go with a patient. It's all a bit sort of about numbers and just dealing with the symptom rather than actually getting to the solution, which I think sometimes you just need that bit more of a sort of it's tough. I don't need to vote. I know you probably know.
No, exactly, but it's nice to relate, because it's just that pressure aspect can stop you doing the best for patients, right? That's why it's been lovely collaborating with Little Earth Baby, actually, because the founder's message is it's all about promoting natural products for baby, and how the introduction of all these synthetic and chemical materials into our life in the past sort of half century, combined with how we are now living, it's unfortunately leading to a lot of problems, and that does need unpicking alongside more traditional medicine and so on. So no, good to hear that we're not alone in promoting that sort of more of a holistic approach, which we must try and not forget about as practitioners, and or make a bit of time where possible. No, lovely to have a chat, and thank you so much for taking the time to join me today. My only attendee, so I'm honoured. We'll be putting this, we'll be sharing this video across social media, etc. But no, really appreciate you taking the time to join me today.
All right. Well, my embarrassing questions won't be on social media, will they?
We'll cut the chat.
That's right. Just to embarrass myself nationally. No, it's a good thing. And I actually went to a lecture quite recently for some dermatologists, and they were saying about how many healthcare practitioners end up with skin problems because we use chlorhexidine washes and all this sort of thing. And it was really, really interesting you say about Little Earth Baby, because I have started being more conscious about what I wash, because so many young babies are getting dermatitises and eczemas and everything like that. And sodium lauryl sulfate, which is even in some of the creams that are given to young babies by their own dermatologists in the NHS, often contains irritants and allergens, and so but it's so good. I like how you're collaborating with such a company that's like organic and has its ethos and the right. Do you see what I mean?